Hello again to our early arrivals, and welcome to everyone who just joined us in the last couple of minutes. My name is Sylvia. I'm the Director of Marketing and Communications at Sylvia Group, and welcome to our annual webinar on Medicare open enrollment. While we allow time for some of the late arrivals to keep logging in, I just want to go over a couple of quick housekeeping items before I introduce our featured presenter. First of all, we'll be collecting questions throughout the presentation with the intention of answering as many as possible at the end. So you should have in your toolbar a Q&A icon. Depending on what sort of device you're on, it could be at the bottom of your screen, at the top, or even in the side panel. But we welcome your questions, and again, we'll try to get to as many of those as possible at the end. Second, within the next couple of days, we'll be emailing you a recording of the presentation in case you want to review it again. You should have it for Thursday, the day that open enrollment begins. And with that, I'd like to introduce our featured presenter, Kristen Edwards, the newest member of the Sylvia Group team, and we're very, very happy to have her. Before joining Sylvia Group as an account executive in our Financial Services and Benefits division, Kristen held similar positions at Blue Cross Blue Shield of Massachusetts and at Always Health Partners. She's worked extensively with Medicare for individuals and with employer-based Medicare Supplement and Medicare Advantage, as well as with Medicare Part D. Kristen, it's all yours.
Thank you, Ben. Good evening, everyone, and thank you so much for joining me for the next hour to learn about Medicare, how it works, what it costs, and the options you have as a Medicare beneficiary. My goal tonight is to educate you and not put you to sleep, so I don't intend to take the full hour, but do want to leave plenty of time for Q&A, so feel free to, as Vince said, put your questions in the chat if you do have them. So I know Vin did give a brief background about me, your presenter, but so I am pretty new to the Sylvia team. I've been here for a few months now, but I have spent my 15-year career thus far in the insurance industry, primarily working, like Vin said, at Blue Cross Always Health Partners, which is a part of Partners Healthcare, as well as New York Life for a short period of time. So for tonight, in this, probably 25-minute or so presentation, I'm going to go over Medicare basics, original Medicare, Medicare Advantage and supplement plans, Medicare Part D, prescription drug plans, how and when to enroll, annual enrollment versus special enrollment periods, and then maybe some additional information as well that you might find helpful. So let's just jump right into the 4 parts of Medicare. The 4 parts of Medicare coverage basically is the reason why there are 4 parts is because they were enacted at different times in our history. So we refer to Medicare Part A and B as original Medicare, Part A being hospital insurance, where Part B is outpatient services such as doctor visits, same-day hospital procedures, lab tests, and x-rays. Then we have Medicare Part C, what is commonly known as Medicare Advantage. While original Medicare Part A and B are managed by the federal government, Medicare Advantage plans are actually private insurance companies that are contracted with Medicare. They do cover everything normally that Medicare covers. However, they do often include additional benefits as well, such as gym memberships, hearing aids, and other value-added benefits, such as over-the-counter drug allowances. Most of these Medicare Advantage plans also include prescription drug coverage. And lastly, that brings us to the 4th part, Medicare Part D, prescription drug coverage. This was the last and most recent coverage that was enacted in 2006. through the Medicare Modernization Act, which made it a requirement for Medicare beneficiaries to have prescription drug coverage. So a deeper dive into Medicare Part A hospital coverage. You will notice in the coming slides an asterisk next to some dollar amounts. This is because these estimated figures are pending final announcement by CMS, the Centers for Medicaid and Medicare and Medicaid Services. Generally, there's no monthly premium for Part A, except if you or a spouse do not have 40 quarters of work history. When hospitalized, sorry about that, it just skipped slides. So when hospitalized, there is a deductible applied per benefit period. This in 2020 is $1,408, which we do expect to increase to $1,452. As mentioned, the asterisk, because that's not finalized yet and should be finalized before the end of the year. So this does cover the first 60 days of your hospitalization. And then after day 61, there is a coinsurance per day that is applicable, which is this year $352 per day for days 61 to 90, which is expected to increase as well for 2021. If you have to move to a skilled nursing facility from the hospital, Medicare Part A does cover 100% of the first 20 days. And then from days 21 to 100, there is a coinsurance applicable as well per day of $176, which again, we do expect to see an increase in 2021. Right now, folks are estimating at about $181.50, but not yet finalized. So let's take a closer look at Part B. Again, as I mentioned earlier, that's for your outpatient services. And for most, the standard Part B premium monthly is $144.60, which again, we do expect to see an increase, but this is still under review. These premiums actually, I know it's still a lot of money, but they only represent approximately 25% of the total cost of the insurance coverage. And there is also an income-related monthly adjustment for those that are considered higher earners, which I will show on the next slide. So individuals earning less than $87,000 or joint filers less than $174,000 pay the standard amount. Anything above these limits will have the corresponding higher premium on a monthly basis as shown in this table. This table is available on the Medicare.gov website as well if you need to refer back to it, but we just like to mention this. So some other things to consider when thinking about signing up for Part B. Premiums are subject to change, of course, each calendar year. Also, if you don't enroll when you're initially eligible, there could be a penalty assessed, which does stay with you as long as you're enrolled in Medicare Part B. This penalty, we get this question a lot, this penalty does not apply to folks that are eligible and choose to work past age 65 or 66 and have employer-sponsored coverage. Either for themselves and a spouse or just themselves. Also, if you have limited income or resources, there is state-specific assistance available, and certainly, we can guide you on that. But there is a lot of information on Medicare.gov as well. So when we talk about your options once you're enrolled in Medicare, you really do have two different paths to choose. And you're not set in stone, you can change your path, and that's what the upcoming annual enrollment is for. But basically you have your original Medicare Parts A and B, and then Medicare Part D, your prescription drug coverage. And if you choose, you can also add supplemental coverage to cover the Part A and B cost sharing, such as deductibles and coinsurances that we spoke about a few minutes ago. The other path you can choose is Medicare Advantage, which, while you still have to pay your Part B monthly premium, your Medicare Advantage plan becomes your primary health insurance coverage and works similar to the traditional HMO and PPO plans that you may be accustomed to today. These often wrap all benefits up into one nice package, and it is pretty seamless for most folks. So a little bit more about Medicare supplement plans, or what a lot of people call Medigap. It's private health insurance that supplements your original Medicare. So it acts more like your secondary insurance, where Medicare Part A and B are your primary insurance. The Medigap policy would be an additional monthly premium, but it does help cover those Part A and B cost shares that you might be subject to should you need services. These style plans do allow you to see any provider that accepts Medicare without referrals or require you to designate a primary care provider. It is portable when you travel, or if you winter elsewhere, or if you decide to move to another state at a later date. Those types of plans can go with you. So Medicare Part D prescription drug plans are available to all that are enrolled and or eligible for Medicare Part A. These plans are also managed by private insurance companies contracted with Medicare. Part D can be purchased as a standalone, for example, if you choose original Medicare and Medigap, or it can be purchased as part of your Medicare Advantage plan. So a little bit more about Medicare Part D, and please don't be alarmed by some of these numbers. Medicare outlines the base coverage for Part D plans each year, effective January 1st. And for 2021, the maximum deductible amount that folks would be responsible to pay is $445. It is an increase from last year of $435. Plan participants share in the cost after that deductible with the plan until total costs reach $4,130. This can be by way of co-insurance or co-payments. A lot of these, this is just a standard outline, and then what the different private insurance companies do is they'll play with the different benefits. They can never go below the standard, but what they usually try to do is enhance the benefits to make them a richer, more robust plan. The next stage is the coverage gap, or I'm sure you've heard a lot of your friends call the donut hole, where you can expect to pay a higher amount for prescription drug costs once you reach that level of coverage, but the drug costs still cannot exceed 25%. And then that brings us to the last coverage stage within the Part D program, which is called catastrophic coverage. And that's where once prescription drug costs, the true out-of-pocket cost of yours as well as the plans is $6,550. You can expect to only have to pay a very small co-payment or co-insurance for the remainder of the year. Like I said earlier, some of these numbers can be daunting and it can be confusing, but the reality is a small percentage of the population actually ever hit some of these higher levels. So it's important to note when you're considering prescription plans that you review a number of details that are listed here. The plan's formulary, which is really just a fancy word for a covered drug list, is a very important piece to picking a plan, because it does vary depending on the different plans that you're looking at. Another is the pharmacy network. If your pharmacy is in the plan's network, that's very important, but also some plans differ the cost sharing based on whether they're standard or preferred pharmacies. And lastly, the overall plan reputation and the varying benefits, such as their deductibles and co-payments and when those deductibles apply, along with considering the monthly premium that we would be paying for the plan, are all key things to consider. As with Medicare Part B, Medicare Part D also has a late enrollment penalty, which is applied if a beneficiary goes more than 63 days without credible coverage. And what credible coverage means is that their drug coverage that they currently are enrolled in is at least as good as or better than that standard Medicare Part D prescription plan outline that I shared earlier. So a little bit more in detail about Medicare Advantage. These plans, again, are offered by private insurance companies contracted with Medicare to provide your Medicare coverage. In most Medicare Advantage plans, you utilize the plan's network of doctors, hospitals, and other providers. Some of these Advantage plans can be HMOs, but they can also be PPOs. So HMO really is can be a narrower network where you do need to designate your primary care provider and obtain referrals to see specialists. Whereas a PPO plan, a lot of times is a much broader network, sometimes nationwide, where you have more freedom to see any provider within that network without designated primary care or obtaining referrals to see those providers. In some cases, those PPO plans also offer out-of-network coverages as well for a higher cost share. It's important to note that when enrolling in a Medicare Advantage plan, that you're still within Medicare with all rights and protections and would still have coverage for the same services covered under original Medicare. But often these plans do have additional value-added benefits to keep you healthy. Plans also have a cap on the amount of money that you can spend out of pocket for services within the calendar year, and vary in different co-payments and deductibles for the types of services that you're seeking, as well as their different value-added benefits to attract you to their plan. Some plans are even offered at a $0 premium, but it's important to note that you do still have to pay your Medicare Part B premium. So enrollment into Medicare can be due to aging in, Social Security disability, railroad retirement benefits, end-stage renal disease, or if you choose to work beyond age 65 once you decide to retire from an employer. If you are already getting Social Security or railroad retirement benefits before age 65, you will actually automatically be enrolled in Medicare Part A and B. Your initial enrollment period is, your initial enrollment package should arrive 3 months prior to age 65, or if you're receiving Social Security disability, you would receive that package 3 months prior to the 25th month of your disability benefits. But really, for the majority of baby boomers now having to wait until age 66 to qualify for full Social Security benefits, you'll actually need to enroll. You will not be automatically enrolled in Medicare A and B. There are different enrollment periods that apply depending on your situation. At the initial enrollment period, general enrollment, and then special enrollment. And then what's really coming up close, starting October 15th, is the annual open enrollment for selecting plans. And that is October 15th to December 7th, with an effective date of your plan change January 1st. So the initial enrollment period is really when you're initially eligible for Medicare. It begins 3 months prior to your initial eligibility, and then typically the month of your birthday, and then 3 months after. So it's really a 7-month window. And so as long as you enroll within that period of time, there is no late enrollment penalty. And as I mentioned earlier, we want to stress this because people get nervous. If you are on an employer-sponsored plan and you continue to work, you would not have to enroll during this period. You would not be subject to that penalty. The next is the general enrollment period. So this period really applies to folks that either miss that initial or just, don't want to pay attention to any of the information that they're getting in the mail, there is this one time during the year that you can enroll, and it is beginning January 1st through March 31st, and that plan would take effect July 1st. Now that's to enroll in Medicare. The special enrollment period does really mostly apply to those folks that are still remaining employed, let's say until 68, 69, 70, and then decide to retire, come off the employer-sponsored plan and enroll. You do have an 8-month window to do so without any penalties. So there are a lot of tools and information out there to help guide your search. I'm sure you get inundated with mail or emails or social media. There's a lot of commercials out there right now, but there are some tools out there to kind of help you weed through all of that information. And Medicare has really worked on their Plan Compare tool. It really helps you narrow down the plans available in your area based on your zip code. You can even enter in your prescription drugs and pharmacy information, which also helps kind of narrow your search and pick the plans that would be applicable to those drugs and pharmacies. Now, we totally understand that this can be very overwhelming, but we're here to help you and guide you. We can review your options based on your specific needs and budget, and we take a personalized approach to each client to ensure the solutions are tailored to you. I would like to just really take a breath and thank everyone for kind of listening in. And I know we're gonna have a Q&A session where we can, Vin will read out the questions and we'll try to answer as many as we can so we can help you along the way. And as Vin mentioned, we are going to be sending out a recording of this too. So hopefully I didn't talk too fast. And if I did, you might be able to go back and listen in again and hone in on specific things that you're interested in. And I truly hope you were able to learn something from this presentation today. And we look forward to helping you. So I am going to just share here my contact information. If you want to get in touch with me, I'm happy to help in any way that I can. I did include my email, my office line, as well as my LinkedIn. And so I'm going to stop talking for a second and let Vin chime in and see if we have some questions.
Thank you, Kristen. We do have a few questions, and we can continue gathering questions if anyone has any follow-ups you'd like to submit. So our first question is, did I understand correctly that the penalty for not choosing Medicare B on time does not apply as long as you're still working after age 65?
Yeah, that's absolutely correct. If you have employer-sponsored coverage, or even if your spouse is on your plan and you're the one working, both of you would be okay until you retire and decide to move off the employer plan. I think in one of the slides it did mention if you're on COBRA, that's not employer-sponsored coverage. So as long as you're still working, absolutely the penalty would not apply.
And here's another question related to Medicare B. Do you have to pay for Medicare B if you're covered under an existing health plan or through a spouse and over age 65?
So if you're on an employer-sponsored plan, you can, a lot of people will just still have Part A because it is at no cost if they have enough work history. But for Part B, they can waive Part B, but we're getting to a little bit of intricacy, so I'm happy to follow up if that person wants to contact me directly, because sometimes if it's a very, very small employer, there could be some different rules, but typically any employer over 20, generally speaking, yes, there would be no problem with waiving Part B.
Okay. And I'm hoping I get the phrasing right on this one, Kristen. It's do you have, I'm sorry, I'm a state worker who has received a statement that I have 32 paid quarters, not the required 40. What would I be required to pay to enroll in Medicare?
I didn't share those premiums, but I can definitely help. If you want to email me directly, whoever had that question, I'm happy to take a look and see what that premium would be with 32 quarters if you don't have if the spouse doesn't have at least 40 quarters.
Okay, we have another Part B question.
Mhm.
On the Part B enrollment, does it require your employer to have a minimum of 20 employees, even if you're covered and under an employer-sponsored plan?
Yeah, so I think I just touched on that. There's some tricky rules if the employer group is under 20, where you may need to still be um, enrolled in Part B. But certainly we can circle back with more details on that with, between under 20 and over 20 to help folks if there's some confusion or anxiousness about that.
Okay, we're also getting some questions submitted in the chat. Okay, let's see. With my pension, I have health insurance, which I forgot to add. Oh, okay, I'm sorry, this is specific about following up with you. I believe you addressed what if you were on your spouse's plan when you turn 65 and are still working?
So if you're on your spouse's plan and you're 65, but you're still working.
Right, that appears to be the question.
Yeah, so if your spouse, let's say your spouse is, 62 and you're 65 and your spouse is still working and you're on their plan, you would still be able to remain on the employer sponsored plan without a penalty.
Okay, if you continue to work, your company has 20 or more employees, and you're enrolled on the group plan, is there any risk to delaying enrollment on Part A and Part B? I know there is a potential penalty on Part D depending on the group plan's prescription plan design.
That's correct. Yep. So employer groups are responsible to send out the Medicare Part D creditable coverage to folks that might be eligible for Part D. And so as long as you have that letter from the employer, you would not be subject to that penalty when you do enroll in Part D.
Okay. Let's see, you talked about IRMA, the Part B surcharge for high-income Part B enrollees. The income test uses the income from 2 years prior, correct?
Yes, that's, I think the chart said 2018. And so that's the most recent chart that's available on Medicare.gov. And, so those are the numbers that we have today. And I would think that they'd probably be updated next year.
And there's a follow-up to that. So new retirees may pay higher Part B premiums for their first 2 years of retirement based on their wages, correct?
Potentially correct, yes.
Okay. All right, if you're already enrolled in A and B and D and do have Medigap coverage, are there specific windows during which you can make changes?
So when you're enrolled in a Medigap plan, you can within with Medigap, you can make changes throughout the year. But if you were specifically considering changing from original Medicare and Medigap to Medicare Advantage, this is the time during open enrollment to be able to do so. So that's really what this October 15th to December 7th is to be able to review your options. But otherwise, I know there are, if you're on a Medigap policy, you can make changes within that, if that carrier offers different Medigap policies, I believe you can upgrade or downgrade during the year.
Okay. And what happens if you retire and elect COBRA for a period of time? For example, because you're undergoing care with a provider who's not part of Medicare. Will you face a penalty?
So you do have 8-month window from when you retire and to enroll without a penalty. So you would have that 8-month window of COBRA. After that, there could be a penalty. And of course, that's not up to me. That's up to the Medicare. So and I don't know if there's ever any appeal process or extenuating circumstances, but you do have that special election 8-month period or 8-month window.
Okay. Could you provide some more details on the differences between Medigap and Medicare Advantage?
Sure. Well, I will try to keep that brief because we could go on for a little bit between the two. And I'd be happy to kind of sit down individually if you'd like to, whoever asked that question. But generally speaking, Medicare supplement plans, you basically, the experience you have is you go to the doctors, you show them your Medicare card, then you show them your Medicare supplement card, and they do bill Medicare first and then the Medicare supplement secondary. So depending on the type of Medicare supplement plan you pick, that supplement plan may pay those deductibles or co-insurances that are applicable under original Medicare. And a lot of times, you would have little to no out-of-pocket costs, where Medicare Advantage, it does work a little bit differently, where you don't show your Medicare card, you just have your, I'm not going to throw out a carrier name to plug any carrier because we work for all of them, but you would just show that one card, and it works similar to the traditional, under 65 HMO and PPO plans, where typically you pay, a copayment, a set amount for those office visits or hospital stay, and everything is submitted from that provider directly to the insurance carrier that you're signed up with. So Medicare is more of a backseat player in those types of plans. That's as general as I can get, but every plan is very different.
Okay, on a related topic, if you retire and enroll in a Medicare Advantage plan and then switch to traditional Medicare and Medigap after 10 years of retirement, can you enroll in Medigap automatically, or can you be rejected based on health status?
You can, yeah. So there is an underwriting process. So when you first are eligible is when there's no underwriting. But if you go down the road of Medicare Advantage and then later on decide to go on to a Medicare, Medigap or Medicare supplement plan, there could be underwriting that is applicable, yes.
Okay, another Part B question. How do you pay for Part B coverage? Do you receive a bill?
So I think, I don't want to speak for everyone. I think a majority of folks do have that Part B premium taken out of their Social Security check before they get that Social Security check. But you can also get billed for it. I'm sure there's, ways to pay it, but a lot of people just have it deducted from their Social Security check.
Okay, and here's one about windows of time. If you're already in a Part D plan, can you make any changes at any time or only during certain time frames?
Only during the open enrollment period,
Okay.
which could be now. October 15th to December 7th, effective January 1st. There could be ways to, if you were just looking to change Part D, coming in the winter as well, January, for that next enrollment period.
And
So if you didn't have Part B, you wouldn't be Part D, you wouldn't be able to enroll in January, but that's when you would do it now.
Sorry to cut you off there, Kristen.
No, no worries.
A follow-up on the Part B coverage. If you do not get Social Security yet, is that where you pay after receiving a bill?
If you're, yeah, so you're getting Part B, but you're not getting Social Security yet?
That's as I understand the question.
That might be something I have to table and understand a little bit more. But yeah, I mean, I'm sure there's definitely a way to pay the bill monthly or quarterly to Medicare. But typically it's coming out of your Social Security. So I definitely want to follow up with that person and get some more detail for them.
Okay. And that looks like that's it for our questions. There were some great ones there, and Kristen, great job by you too on the presentation and the Q&A. Thank you all for participating tonight. Thank you for your questions. Again, within the next couple of days, I'll get an email out to you with a recording of the presentation, and it may take a little while because I'd like to transcribe the Q&A session as well to present that in a blog post. But thank you. And if you have any questions, you have Kristen's contact information. She'd be happy to answer your questions. And if I can be of any assistance, you can reach me at vsylvia@sylviagroup.com. Thank you again. Have a great night, everybody.
Thank you, everyone.